Have you ever experienced persistent abdominal pain, felt an uncomfortable mass in your belly, or had digestive issues, especially after a difficult episode of pancreatitis? These could be signs of a pancreatic pseudocyst, a fluid collection that sometimes forms near your pancreas, and knowing the options for treatment is truly empowering. Pancreatic pseudocysts are surgically drained through various procedures, primarily to alleviate uncomfortable symptoms and to prevent serious complications. The most common approaches include minimally invasive techniques, such as endoscopic drainage where a thin, flexible tube is used, or laparoscopic drainage which involves small incisions and specialized instruments. In certain situations, a traditional open surgery might be necessary. The decision on which drainage method to use is not made lightly and hinges on several critical factors. A pseudocyst is essentially a collection of pancreatic fluid, dead tissue, and inflammatory cells, encapsulated by a fibrous wall, but lacking an actual epithelial lining. These can develop weeks after acute pancreatitis or pancreatic injury. Doctors consider the pseudocyst size and its precise location, particularly its proximity to the stomach or intestines. They also assess if it is causing significant symptoms like pain, nausea, or infection, and whether it is pressing on nearby organs. Furthermore, the overall health of the patient and the surgeon's expertise with specific techniques play a vital role in determining the safest and most effective approach. The primary goal of surgical drainage is to create a pathway for the fluid inside the pseudocyst to empty into the digestive system. For endoscopic drainage, a physician typically guides an endoscope through the mouth and esophagus into the stomach or duodenum. If the pseudocyst is bulging into the stomach or duodenum, a stent can be placed to create a connection, allowing the fluid to drain internally. Laparoscopic drainage, performed through tiny incisions in the abdomen, involves creating a window into the pseudocyst and connecting it to a part of the small intestine or stomach, effectively rerouting the fluid. Traditional open surgery, while more invasive, allows for direct access and drainage, and is generally reserved for very large or complex pseudocysts, or when other methods are not feasible. A key distinction in surgical planning is whether the pseudocyst communicates with the main pancreatic duct. If it does, and especially if there is a stricture or blockage in the duct, this might influence the type of drainage or additional procedures needed to ensure proper pancreatic flow. Sometimes, special endoscopic ultrasound guidance is used to precisely identify the optimal entry point for drainage, minimizing risks and improving outcomes. Understanding these nuances helps tailor the treatment to each individual's unique condition. Ultimately, the various surgical drainage techniques for pancreatic pseudocysts aim to resolve your symptoms, prevent potential infections or rupture, and help you return to better health. By understanding these options and discussing them thoroughly with your medical team, you can make informed decisions about your care and work towards a successful recovery, ensuring your pancreas can function more comfortably and effectively.